let's get into the carpals then. These are the carpals are they're short bones, okay? And they are going to make up the wrist. All right, so you have 8 carpal bones, and they're arranged in 4 rows. Did I say 4 rows? I'm sorry, 2 rows with 4 bones in each. So you have what's known as a proximal row. That's going to be the row that's closer to your elbow. And then you'll have the distal row, and that's going to be the row that's closer to your fingertips. So when we arrange the bones, we're going to go from lateral to medial. All right, so what does that mean? If you're in the anatomical position, we're going to start on your thumb, and we're going to work towards your pinky. Okay? So I don't do a lot of mnemonics. Does anyone here study with mnemonics? I used to, but then I had to learn what the mnemonic meant, and so it took up even more memory, so I just straight up memorized. But this is one of the few mnemonics that I do know, and there has been studies. I try to keep all my mnemonics PG, okay? But there are studies out there that the more R-rated the mnemonic, the better people can memorize it. But I know that my mnemonic is good because I saw it in an episode of ER. Has anyone ever seen that show ER? It was a long time ago on NBC. So this is how old this mnemonic is. It's probably way before that. But, all right, so the scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, hamate. Here we go. Ready for the mnemonic? Silly. Well, actually, you know what? I'll just type it out too. And bear with me on this, okay? So I didn't come up with that, all right? That's not mine. So it says silly lovers try positions that they can't handle. And if you see, if we go through the first letter of each of these, S for silly is S for scaphoid. L for lovers, L lunate. So you can kind of see where we're going with this. Triquetrum, try, all right? Pisiform, positions. And then trapezium, that. Trapezoid, they. Capitate, can't, and then H for hamate, H for handle. Kind of see? So again, if you really want to try to work on mnemonics for other things in the course, you can always go on Google. I found some there's one for the cranial nerves that's pretty graphic. Yeah, that's funny. I'm not coming to get you. Watch this. I'll go get them. Hold on, let me switch to the next. He's laughing. All right, here, I'll go grab them. All right, copy that down really quick. I'll be right back. All right, so that's for the metacarpals. Those are the bones in your palm. So the metacarpals are going to be the bones of the palm. So you have 5 fingers, you'll have 5 metacarpals, okay? So here's the thing. The metacarpals are going to be used when we talk about labeling. We use Roman numerals. So, I don't even know if they teach Roman numerals anymore in school. But here we go. That's 1. This is 2. This is 3. One more. This is 4. And this is 5. Okay? So keep that in mind. So if I'm asking you about the first metacarpal, then it's going to be Roman numeral number 1. If I'm talking about the 5th metacarpal, it will be Roman numeral number 5. Your middle finger will have Roman numeral number 3. Okay? So you want to know that. Okay? And then 4 is 1 in front of the V. Okay? But basically, these are the bones that make up your palm. They attach onto the carpals. Okay? And so they will then articulate with your phalanges. And you can see here are the metacarpals. All right, nice X-ray here. So you can't really see them individually like you can your fingers, but they're in the palm of your hand. You have 5 of them. Okay? So starting with the thumb, that's number 1. Pinky is number 5. Okay, so you can see how they're highlighted. Metacarpal number 1 is the thumb. Metacarpal number 5, metacarpal number 5 is the pinky one. Okay, and then you can figure out the rest. All right, here's a nice example. All right, then finally, the phalanges. Those are going to be your digits. Okay, so you have 14 phalange bones. Okay, but here's the thing where most people get confused. All right, the phalanges, you're going to have 3 per finger except for the thumb. The thumb has 2 phalanges. Okay, another name for the thumb is called the pollex. Okay, so the thumb has 2, and then your other fingers each has 3. Count your knuckles. You only got 1 knuckle here on your thumb if you're not counting that knuckle. Then, but your other digits have 2 knuckles. Okay, it's an easy way to remember. So your fingertip is going to be the distal phalange. All right, and then if you're moving towards your palm, the next phalange will be the middle phalange. And then when we get close to the palm, you'll have your proximal phalange. And you name your phalanges the same way you name the metacarpals, with Roman numerals. So if I want to talk about the phalange on the tip of my index finger, then I will say that that is the distal phalanx or distal phalange Roman numeral number 2. Because my index finger is my 2nd digit, thumb being the 1st. Thumb is always number 1. All right, I'll show you. I'll show you what we're talking about here, okay? So here you can see all the different phalanges here. So your fingertips, all right, this is a distal phalange. That's distal phalange number 1, Roman numeral 1. All right, this is going to be Roman numeral number 2. Can't really see that. Roman numeral number 3, Roman numeral number 4, and then Roman numeral number 5. Okay, so keep in mind, all of the digits have a distal phalange. Here's the distal phalange for your thumb. Here's the distal phalange for your index finger, distal phalange for the middle finger, ring finger, pinky. All of the fingers have a proximal phalange. Here. Here's the distal phalange. Here. Only digits 2 through 5 have a middle phalange. Remember, the thumb only has 2 phalanges. It's not going to have a middle phalange. Okay? Keep that in mind. So here you can see all the proximal phalanges are highlighted in blue. They articulate with the metacarpals. This is the palm of your hand. All of the fingers have a distal phalange. Again, it's highlighted in blue. But only digits 2 through 5 have a middle phalange. Are we cool? All right? Cool in the gang? Anyone name the movie? Oh. I can't even think of it for a second. Give me a second. It's a Quentin Tarantino movie. Oh, when he has to stick the needle in the guy's chest. John Travolta, Sam Jackson. Pulp Fiction. Thank you. He's like, are we cool? Cool again. All right, anyways. All right. We'll go through all the labeling here very shortly. Okay, so one of the clinical topics are scaphoid fractures. This is one of your carpal bones, all right? Now, the problem is with the scaphoid fracture, all right, it is heavily vascularized, but one of the problems is when you damage this bone, you will tear some blood vessels. If you do not correct that, you will get what's known as avascular necrosis. We know what necrosis is. What's necrosis? We talked about it in tissues. Tissue death. Yep. So if you don't get blood to a tissue, and bone's a tissue, all right, it's connective tissue, okay? If you don't get blood to that, it will die, all right? So it takes a long time for this bone to heal, right? That's a scaphoid fracture. So how do you break it? You slip on the ice. Thank goodness we don't have to worry about that too much here. All right, and an outstretched hand. Your palm is out. You slam down on it. Bang. Okay? It's right by your thumb. Remember, silly lovers, scaphoid. Commonly fractured. Ooh. All right, we're almost done with the skeleton. I know some of you would be happy. Who here is looking forward to moving on to muscles? Anybody? Okay, we got one person. It's okay. I look forward to moving on to everything because it's just happy, fun stuff. But anyways, that's just me. All right, so let's talk about the lower extremity. Now remember, when we're talking about the appendicular skeleton, all right, we talk about both upper and lower extremities and the bones to which they articulate with. So now we're going to talk about the hip bones, but now we're going to give it a different name. So there's two structures that I want to draw your attention to. One, the pelvis. Two, pelvic girdle. Okay? So you need to know the difference between the pelvis and the pelvic girdle. The pelvis includes all 4 bones. What does that mean? Your left and right hip, the sacrum, all right, we already know what the sacrum is, and the coccyx. We know what both of those are. We've seen them already. Okay, so the only things that we're adding into this now are the right and left hip bones, which are called the os coxa. Okay, so this is going to be, when we talk about the pelvis, this is going to be where that pelvic cavity is located. All right, so inside the pelvic cavity are going to be all the organs there. So this is what the pelvis does. It helps to support all the organs, all right, in the pelvic cavity. Pelvic cavity is the lower portion of the abdominal pelvic cavity, which is part of the ventral body cavity. Ventral body cavity includes the thoracic cavity and the abdominal pelvic cavity. Okay? All right, so what the heck is the pelvic girdle? That's easy. Both the left and right hip bones, the left and right os coxa. All right? Does not have to do anything with the sacrum or the coccyx. That is where your lower extremities articulate with. Okay, so the pelvic girdle is going to have that slight anterior tilt to it. It's going to go forward just a little bit. Some of us have it too much, and it causes an increased arch in the low back. That's bad. All right, too much of an anterior tilt is not good. A slight amount is fine. Too much, which a lot of people will have, more than they should, okay, that's not good. So here's the pelvis. So it's including, all right, the hip bones here. I'll start to use the correct terms here shortly. All right, here are the hip bones. Here's the sacrum. Here's the coccyx. All of this is, don't include, these are the vertebrae. Don't include those. All right, that is the pelvis. All right. Here's the pelvic girdle, highlighted in blue. Just the hip bones, sans or without the sacrum and coccyx. Cool? Cool, 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 cool. And if you look, we're comparing the male pelvis to the female pelvis just briefly here, and you can see, all right, if you compare the male pelvis to the female, look at this. This part of the pelvis flares out more. Okay, this does not. The opening here is much larger than the opening here. All this is for what? Baby. Yeah, making room for baby. You know, got to make a nice, comfortable home. Men, we're not so suited for it. Women, yes. All right. You can also see these structures here. These are called the obturator foramen. You can see those much better, they're more prominent in the female than they are the male. And then this is called the subpubic angle. It's much bigger than the males. See, it's kind of more acute, smaller. Female is larger. Okay.
On the practice test, they show one of them, and you have to
tell which one is which. Yeah, yeah, yeah. Don't be surprised if you get that on the test.
Oh, I know. I mean.
Okay, so let's talk about some of the bones now. Okay, the pelvis. Let's get into the pelvis. All right. So the os coxa. I will no longer refer to it as the hip bone. All right, those days are over. The os coxa. All right, the os coxa was the bone that I used to refer to as the hip bone. At one point, was made up of 3 individual bones, and over time they fused together. Okay, so you do need to know the name of these 3 bones: the ilium, the ischium, and the pubis. Okay, again, this is another way where we can identify skeletal remains. If these bones aren't fused together, then we can see, okay, well, this person is below the age of 13 to 15 because they're not fused. All right, very helpful with that. All right, so the os coxa are going to articulate with the sacrum, all right, and form one of the coolest joints in the whole body, the sacroiliac joint. It's an often disrespected joint, but nonetheless, it plays a big role in a lot of things. Okay, so you need to know that because that is also a test question. You will be asked to identify the joint, and it's known as the sacro. All right, that's one bone, and then iliac is going to be the other bone from here, the ilium, which is part of the os coxa. Okay, sacroiliac joint. All right, so here's the os coxa. This is a lateral view, meaning, okay, we're looking at it on the lateral side. How do I know this? Well, this structure here, we'll learn it in a second. It's called the acetabulum. That's where your femur fits. Okay, so it's on the outside. Okay, so this portion, all up in blue, the superior portion of the os coxa, that's the ilium. All right, the ischium makes up this portion of the os coxa. This is the back side or the posterior side. This part right here, all right, it's called the ischial tuberosity. We'll label that shortly. That's the part that you are sitting on right now. Okay, otherwise known as the sits bones. And then in the front, here's the pubis. Some people have referred to it as the pubic bone. Okay, so if you want to feel the pubic ramus here, just find your belly button, go 2 inches inferior to it, below it, and press down. You'll feel something hard. That's the pubic bone, or the pubis. All right, that's going to be in the front. All right, here you can see it, all right, from the anterior view. Here's the ilium, makes up the top superior up half of the os coxa. You can see an ischium on the back side here, and then in the front, here's the pubis. Okay, so when we're looking at the os coxa, specifically on the lateral surface here, we're going to see the acetabulum. All right, and the acetabulum is that cup. Okay, so here's our cup, and the femur head sits right inside of it. And that forms what we call the femoral acetabular joint. Now, a lot of people will say their hip joint, okay? And technically, you kind of have 2 hip joints. You have where the femur articulates with the os coxa, the hip bone there, and then also where the os coxa articulates with the sacrum, at the sacroiliac joint there, okay? But one of the things about the acetabulum is all three bones come together inside of there and fuse. Now, if we look at the acetabulum, all right, you've got this one part of the acetabulum which is called the lunar surface. That's like this part. It almost looks like the moon, okay? And that's nice and smooth. And that's where the head of the acetabulum is going to attach itself to, okay? The head of the acetabulum is lined with articular cartilage, hyaline cartilage there. And so is this area here. The lunate surface is smooth, and then that is where the head is going to articulate itself with. So you can see here's the acetabulum, this whole cup, and then this smooth portion right here. All right, that's the lunate surface. You can see it highlighted in blue here, blue-green. So if you could see the acetabulum, you know that you're looking at the lateral surface, all right, of the os coxa, right? Makes sense, because my hip bones are here, all right? They come into the lateral surface. It's not the medial surface. It's not on the inside, okay? So if you see the acetabulum, you know you're looking at the outside of the bone, the lateral surface there. All right, so let's go through, okay, each bone of the os coxa here, okay? The first one, this is the largest of all three, is the ilium. All right, it's going to make up the upper half of the superior region of the os coxa. Okay, so where it kind of fans out, all right, you have this fan-shaped area. That is called the ala. All right, now again, you don't need to know the arcuate line, all right, for identification purposes. All right, but you do need to know the iliac crest. So when you were younger and you were in school and your teacher told you to put your hands on your hips, what he or she should have been saying, if they wanted to be anatomically correct, would be put your hands on your iliac crest. Because when you put your hands on your hips, that's the iliac crest. That is what you're feeling. That's the top or the superiormost ridge of the ilium. Okay? That's the iliac crest. Now, the iliac crest, when we go from the front, all right, we'll see a little knob or a bump on the front of the iliac crest. That is known as the anterior superior iliac spine. You do need to know that for ID. And we'll see that. We'll go over that. Okay. And then below that, you have the anterior inferior iliac spine. You don't need to know that for the test to identify. If we go all the way towards the back, on the back portion of the iliac crest, you'll feel a bump. If anyone feels a bump on the back of their, if you follow your hip bone back, you'll feel two bumps on either side of your spine. All right, you feel them? Those are your PSISs. Don't say that. Say posterior superior iliac spine. All right, that's the back side here, the posterior superior iliac spine. You do need to know that for identification purposes. Okay, and then if we follow further down, all right, we'll have a smaller bump, and that's the posterior inferior iliac spine. You don't need to know that. Right? Moving our way further down on the ilium, you're going to see a notch. All right, I'll show you. It's this big old notch, big, big, big. That's where the sciatic nerve emerges from the pelvis and goes down the back of your leg. Sciatic nerve is the longest and biggest nerve in your body. By the way, a named nerve is actually considered to be an organ. Isn't that crazy? It's an organ. All right, so now we're going to go on the medial side of the os coxa. Now, the medial side, on the inside, all right, we have this big smooth area. Remember those, the ala, those are the parts of the bone that flare out. You do need to know this, the iliac fossa. All right, the iliac fossa, there's a muscle that sits there. It's called iliacus. We'll visit that later on. But that's on that smooth surface there. Okay? And then, yeah, this other stuff you don't have to worry about, the anterior, posterior, inferior gluteal lines, because you don't need to identify that. So here's your iliac crest right here. Okay, so here is the front of, this is the anterior. This is anterior. This is posterior back here. So if we follow the iliac crest all the way to the front, this bump right here, all right, that is the anterior superior iliac spine, that little bump there. If we follow it all the way back to those bumps that you feel on either side of your spine, that's the posterior superior iliac spine. Okay? So again, you can see here, there is our ilium. On the inside of the medial surface, this smooth region there, that's the iliac fossa. And that's where iliacus, that muscle sits. You need to know that that's called the iliac fossa. So this should look familiar to you, auricular surface. Remember we saw the auricular surface on the sacrum? All right? So we also have an auricular surface on our os coxa, on the ilium, because that's where the sacrum is going to articulate with the os coxa. And that's going to form your sacroiliac joint. Right? You don't have to worry about arcuate lines and anterior gluteal lines. Yeah, again, when we get to the identification portion, Candace, I will explain that all to you. Yep, I'll show you. Anterior, posterior, lateral, medial. Yep. I won't leave you hanging. All right, here is the greater sciatic notch. All right, that's right below that auricular surface. That's where the sciatic nerve is going to exit out of. All right, you can see now, here's the auricular surface of the ilium. And then when we press the sacrum up against the os coxa, those two auricular surfaces will form the joint, the sacroiliac joint. All right, let's get on to the second bone of the os coxa, the ischium. This is the bone that sits on the back, but it's inferior. Okay? So this is going to be this inferior superior portion of the ischium here. So we're going to see this little structure is called the ischial spine. The ischial spine is found in between the greater sciatic notch and the lesser sciatic notch. So it's this little bump that comes off. And so here's the spine, all right, and then below it you'll have this notch. And that notch is the lesser sciatic notch. And then as we move further down the bone, you're going to have the ischial tuberosity. Ischial tuberosity is what you're sitting on right now. So this structure is bearing all of your weight of your upper body on it. I like to point out that the ischial tuberosity is where your hamstring muscles attach onto. Okay? So while you're sitting on the ischial tuberosity, you're also sitting on the attachment site of your hamstring muscles. All right? Then as we wrap around towards the front, going towards the pubis, before we get to the pubis, right, we have the ischial ramus. You don't have to know this for identification purposes, but this pretty much extends from the ischial tuberosity, all right, to the pubic bone. And I'll show you here. All right, so here is the ischium, this whole back area here. Okay, and you can see part of it is inside the acetabulum, as is the ilium, as is the pubis here. Okay? So this little nubbin that you can see, here's the greater sciatic notch. Then you see this little nubbin, all right? That's the ischial spine. And then right below where that little nubbin is, okay, that's the lesser sciatic notch. You can see it here, you can see it here. Okay? As we continue down past the lesser sciatic notch, we get to here, the ischial tuberosity. Okay, that's where you're sitting on right now and where your hamstrings muscles are attaching to. And then pretty much from the ischial tuberosity, all right, up to the pubic bone here, this little stretch, you can see it. It's highlighted here. It's right below the obturator foramen. All right, that's the ischial ramus. Okay, you don't have to identify that for the test, but you should just still know it's there. Okay, last part of the os coxa. Then when we're done doing the pubic bone, we're going to label the upper extremity stuff, all right? All right. So our pubis, again, this is the third bone out of all three, Okay, again, it's going to be found fusing with the ischium and the ilium, all right, inside the acetabulum. All right, so your pubic bone is kind of like this. Extends out, and then it goes back down, and you have the obturator foramen. So the part of the pubic bone above the obturator foramen, that hole there, that is known as the superior pubic ramus. And then below it, we have the inferior pubic ramus. Okay? So kind of in between the two rami, we'll have that obturator foramen. That's that hole there. That's the obturator foramen. So above it is the superior ramus. Below it is the inferior pubic ramus. Here, I'll show you a better picture here. There we go. All right, so here you can see, here's the pubic bone. Okay, here's your obturator foramen, the hole there. So again, it's tough to see on here, the angles, but above the obturator foramen, going from the acetabulum, all right, out here towards the pubic symphysis, that is going to be the superior pubic ramus. It's above the obturator foramen. Below it, right over here, that's the inferior pubic ramus. So when we go and do the labeling here, it'll be a little bit easier. We're not going to do that today. All right. And then where the two os coxa, the two bones come together, right, and meet in the front, all right, they form a joint, all right, called the pubic symphysis. And in between those two bones, you have a disc of fibrocartilage. Remember, there's only 3 places in the body that fibrocartilage is present. Right? The intervertebral discs, the menisci of the knee, and the pubic symphysis. And the pubic symphysis is where your right and left os coxa, or your right and left pubic bones, articulate with one another. Okay? So if we're looking at one pubic bone, you know how we saw the auricular surface on the sacrum, or the auricular surface of the ilium, right, which is a joint surface? You have what's called the symphyseal surface of the pubic bone here. That's what this right here is showing you. Come back to that. Right here. Okay, so that's going to be the surface, all right, that's going to articulate with the fibrocartilaginous disc, and then on the other side of that disc, you'll see the other os coxa. All right, you don't have to know that other stuff for identification purposes. So. Yeah. All right, we know that, we know that. All right, let's just quickly talk about some of the sexual differences between male and female pelvis, and then we can get into the labeling portion here, okay? If you can keep in mind the whole time when you're looking at a pelvis, all right, that a woman's pelvis needs to accommodate the actual pregnancy and childbirth, all right, then when you're looking to be able to identify the differences between a male and female pelvis, it will become much more abundantly clearer to you, all right, why the female pelvis versus the male pelvis looks the way it does. Think about it for example, female pelvis, all right, is shallower and wider. We know why it's wider, right? Need to make more room for baby. Why shallower? Think about it. Would you rather, and I'm not even a woman, and I know for a fact that I would much rather prefer to push a baby 5 centimeters out of my body than a foot out of my body, right? So if it is shallower, right, shorter birthing canal, that's exactly right, okay? So the female pelvis will be shallower, and obviously we know why wider, okay? So hence, we'll have wider hips. Okay, that means that the ilium in the female pelvis will flare more. Okay, we saw that. All right, it'll flare out more. Because of that, we'll also see the acetabulum on the female pelvis is going to be projecting much more laterally. This is partly why women have a better center of gravity than men. Makes you much better rock climbers than us, for example. That's a if that's something that you're into. All right. Women will also have a wider greater sciatic notch. Right. And part of that has to do with that flaring all right, of the acetabulum. Okay. Okay. So when we look at the female sacrum, again, it'll be shorter and wider. All right. And we'll also see, all right, when we're talking about the pubic bone, right, because they're longer and have a much more rectangular shape, that subpubic angle, remember that angle where the two pubic bones form in between, all right, the pubic symphysi, all right, it's going to be much wider or more convex. The men's looks like this. Women's look like this. I'll show you. It'll make it much more abundantly clear when I show you. All right. So here's the subpubic angle. Look at it, men. Okay? It's like a V. Women, it's like more like a U. All right? We have a much more wider, all right, pelvic inlet here. All right, and the pelvic outlet is going to be much wider in the female pelvis compared to the male pelvis. Inlet, all right, because baby's coming down. Goes down and out. Okay? So this first part here, this is called the pelvic inlet. And then this is the pelvic outlet. You can see. So look, flares more. The ilium flares more. Sacrum is shorter compared to the male sacrum. All right, all makes sense during childbirth. Okay, and then you can see how your acetabulum are going to be more laterally facing compared to the males. Okay, I'm going to save the rest for the bones of the lower limb for next lab class. Let's do some labeling. Let's rest our brains for a few moments. Do some nice labeling. All right, talk about the appendicular skeleton a little bit. Okay, so keep in mind, like I said before at the beginning of the class, appendicular skeleton, upper and lower extremities, and the bones or the girdles. All right, remember we had the pectoral girdle in the upper extremity that included the clavicle and the scapula. In the lower extremity, we have the pelvic girdle. Okay, so pelvic is going to be lower extremity, and then the pectoral girdle will be the upper extremity. All right, so let's jump in. That is the clavicle. Okay, the most easy, well, I shouldn't say the most easy, the easiest bone to fracture in the body. Here's a fact. The central portion of the clavicle undergoes what type of ossification? Intramembranous or endochondral? It's one of those weird bones. Intramembranous. Okay? The ends here, all right, these guys undergo endochondral. Clavicle's weird like that. It undergoes two different types of ossification. Okay, so you need to know which end is which. The pyramidal or the pointy end is the sternal end. Obviously, that's going to be the part that is going to articulate with the manubrium, which is the upper bony portion of your breastbone, your sternum. Okay? We go to the far other end. That flattened end looks like a spoon. That's the acromium, right? Or the acromial end. All right, so we have a little bump here at the bottom, right here. See that guy? I need you to pay super, super close attention to its spelling. Conoid, C-O-N-O-I-D. We're starting to overlap on some terms here. Not yet, all right? Remember the coronoid process that we saw in the mandible? Well, we're going to revisit the coronoid process, all right, of the humerus. All right, so conoid, C-O-N-O-I-D, tubercle, that little bump on the inferior surface of the clavicle. All right, so check it out. And I hope, Candace, this will help you to understand which is posterior and which is anterior, because I'm going to start talking about that. All right, so here we are with the scapula in this flattened area here, okay, this flattened side. All right, remember, your shoulder blades sit on your back. All right, they're like your wings, okay? So you want the nice smooth side to be rubbing against your ribs. You don't want any bumps. Well, guess what? Look at this. This looks like a big bump. I sure as heck don't want that rubbing up against my ribs. That hurts. Okay? So the anterior surface is going to be the surface that's going to lay right on your back. And then if I'm standing behind you in line at the quickie marks, this is the side that I see. This is the posterior surface. Okay? So keep that in mind. All right. So the top part here, we're going to go over the borders. All right? This is the superior border, or you can say margin, of the scapula. Okay? I'm going to show you this. I hate showing this slide, but I got to show it to you anyways. Where that arrow is pointing, right? It is a general term that we use to describe this is the body of the scapula, but there's another term for where this arrow is pointing. Most people will refer to it as the infraspinous fossa. Okay, and I'll show it to you again. All right. So if you see on a test, there's a circle here, and it has the arrow pointing to this region, then you can refer to it as the body of the scapula. I need to point that out in case there's a test question on it. I don't think there is. Normally, I don't show the slide. All right, and I'll show you why in a moment. All right, so, all right, whoops. Come on, hold on. All right, so look, this is the posterior side, right? We can see the spine. Okay, now I'm going to flip it over. Here's the anterior side. Okay, same thing, superior border or margin. Okay, I'm going to show you both sides in a lot of these slides here. All right, so let's now look at the next margin. This is, again, the anterior side. This is the medial border. How do I know that this is the medial border? Okay, well, over here, that's the glenoid fossa, and I'm just drawing in the head of the humerus. Here's your humerus. So this is your armpit right here. Okay? It's easier to see when there's an extremity attached, which is the medial and which is the lateral. Okay, so let's flip it. Wait, did I skip? Did I show you both sides? No, here you go. All right, so here's the medial border from the posterior view. Here's the medial border from the anterior view. I thought I had two views. Okay, and then the next one, back to the posterior side. This is the posterior view. I'm standing behind you. Here's the lateral border. Because again, here's the head of the humerus, all right? And there's the diaphysis of the humerus. So this is the armpit right here. So that's lateral. Your spine would be over here. Okay? So we flip it over. On the anterior view, there's the lateral border. Okay. So now we go back to the posterior view, and you can see the spine of the scapula. Spine of the scapula is a very, very important landmark to know because it's going to demarcate certain regions of the scapula, and I'll show you what I mean. So if we follow the spine of the scapula up to this flattened structure here, all right, that's known as the acromion. You may also have heard that it's referred to as the acromial process because it is a process. It is coming off the scapula though. All right, so here's the view of the acromion from the posterior view. Now I'm going to show it to you, all right, from the anterior view. All right, that's all of this. Not this, but here, you can see it. This is something else. I'll outline this other process that you can see. Okay, so this is from the anterior view. So the acromion is behind this other process that we're going to talk about here. And I'm going to show it to you from another view. This is the lateral view, okay? So which is the front, which is the back? Well, here's the spine right here. So if that's the spine, this must be the posterior side of the scapula. This must be the anterior side. The spine of the scapula is always on the back of the scapula. Okay? Okay, good so far? Not too bad? Okay. All right, so now we're going back to the posterior view. This region up here, this depression, that's known as the supra meaning above, spinous fossa, supraspinous fossa. All right, staying on the posterior side, let's go below the spine. That's the infraspinous fossa. Now check this out. Isn't this arrow also pointing to the infraspinous fossa? That's why I hate showing the slide, okay? So normally I don't, but I have a feeling if I don't, it'll come back and bite me in the butt. All right, so that's the infraspinous fossa. So some of you are thinking, well, what happens if I put body? Just put the infraspinous fossa, I won't mark you wrong, unless the question asks you to identify it other than the infraspinous fossa. Okay, so here's the infraspinous fossa below the spine. Now, we're going to flip the whole scapula over. We go to the anterior surface, and we have the subscapular fossa. The subscapular fossa is where your subscapularis muscle lives. All these fossas are places for muscles to live in. And we'll talk about the muscles when we do the muscles. Okay, so let's go talk about our other process. Okay, so looking again, here's the posterior side of the scapula. Here's the anterior side of the scapula. This is the acromion. And here's the other process, the coracoid. Check out the spelling. There's an A in there. All right, C-O-R-A-C-O-I-D, coracoid. It's a site for muscular attachment. One of the muscles we're going to learn later on is the coracobrachialis. Okay, so that's the coracoid process. That's on the front, on the anterior surface. The acromial is more on the posterior, on the back side. So let's look and see from the anterior view. There's the coracoid process. All right, almost done with the scapula. So we got to talk about the surface or the structure that the head of the humerus articulates with. Here's a lateral view. This is known as the glenoid fossa or the glenoid cavity. All right. That's this whole thing right here. The head of the humerus articulates there, and it forms your shoulder joint or your glenohumeral joint, the most mobile but one of the most unstable joints in your body. Okay? So that's the glenoid fossa. I'll show it to you from the anterior view here. There it is. Glenoid cavity or glenoid fossa. All right, enough with the scapula. Let's get into one of our long bones here. Let's talk about the humerus. Okay. So the head of the humerus is going to be this nice, smooth structure here. Okay, you need to be specific. This is the head of the humerus. Okay, so that's important, and I can't stress this enough, but I'll repeat myself and say it again. Make sure, all right, when you start to study for this stuff, all right, you should have been already starting to study for it. Be able to identify the bone. First off, just know what bone you're looking at. I don't care if it's C1, C2, sacrum, coccyx, femur, radius. People, I'm telling you this right now, People confuse the tibia, the radius, the ulna, femur, and the humerus all the time because they're long bones and they don't know the bones well enough, and that's easy points. So don't do that. So you should be able to look at a bone, all right, and say, all right, that's the humerus. Okay, you need to know that. All right, and then you could start learning the anatomical landmarks and structures on that bone. So here's the head. Okay, and so usually if we have a head, we're going to have a neck. But the humerus is funny like that because it has two necks. It has the anatomical neck here, all right, and that's actually, the anatomical neck is where the actual growth plate is. Normally, we see the epiphyseal growth plate in the metaphysis, and that's where the epiphysis starts to kind of taper down. Okay, but we don't see that in the humerus. Humerus is special. All right, so that's the anatomical neck. That is where the epiphyseal growth plate used to be. Then we get down here, the actual narrowing of the epiphysis, that's the surgical neck. Common fracture site. We talked about that last week. All right, so that is the surgical neck. The humerus has two necks. All right, so now we're going to talk about a few of the bumps here on the humerus. So the first big bump, okay. Oh, shame on me, shame on me. All right, so looking at this humerus here, this bone, look at the big one, the whole bone here, okay? This is the anterior view of the humerus. Wherever the head is always going to be the medial side. That makes sense, right? Because the head is going to articulate onto the scapula to form the shoulder joint. So the head is always going to be medial. If it was lateral, that wouldn't make sense because your shoulder blade is over here. Okay, I'll draw it like a triangle. Okay, so that's the medial side. This is the lateral side. And it'll make more sense because when we get down here, this structure here, I hate to do this, but I'm going to tell you anyways. What I just circled is the funny bone. You guys know your funny bone, right? Because you may have whacked it once or twice and got that weird tingling sensation. You can feel it on the inside of your elbow. All right? We're going to learn the actual name for that. So two of the ways that you can tell which is the medial side and which is the lateral side. One, look for the head. Okay? Two, look for the funny bone. Wherever you see that big bump, that's going to be the medial side. You got it? Okay? So medial, lateral. All right, good. When we get down to the distal end, down here, I'll show you a way how to tell if you're looking at the front or the back, the anterior or posterior. All right, when we get down there. All right, on to the next part. This bump here, big bump, we call that the greater tubercle. Site for muscular attachment. It's a big old bump. The greater tubercle. If we have a greater tubercle, we're going to have a lesser tubercle, so it will be a bump. It will be smaller, but the lesser tubercle is right over here. Okay, hard to see at this angle and plus with the contrast, but that's the lesser tubercle. So you have an area in between the greater and lesser tubercle. It's like a groove here. So of course we're going to give that a name. And we're going to call that, there's a couple names up there. Bicipital groove, because that's where the tendon of the long head of the biceps sits, but you can call it the intertubercular groove. All right, that's a groove that just, what that means is it's a groove between two tubercles, two bumps. Or you can call it the intertubercular sulcus. All right, that's what it's representing, because here's your greater tubercle, here's the lesser tubercle. So it's a groove in between both of them. All right. So moving down, not quite midway, and it's really hard to see, so you got to use your imagination. You can draw it in. There's a bump right here. All right, that's the deltoid tuberosity. That is where your deltoid muscle inserts onto your humerus. The deltoid muscle allows for what we call AB, abduction. That's basically moving your arm straight away from your body, like when you do jumping jacks. All right. All right. So now we're going to go down to the distal end, down here. So now this brings me into how I can tell that this is the anterior view. And it has to do with these structures that we're about to look at. All right. So there's two structures down here that we're going to start talking about. The first one is actually circled here. That's called the capitulum. The capitulum is where your radius, which is this one of the two bones in your forearm, articulate with. And this other structure is called the trochlea. The trochlea, to me, looks like a bow tie, like that. Okay? So when you're able to see the capitulum and the trochlea, all right, as nice as you see them, all right, then you know you're on the anterior view. You can't really see it on this model very well, but you have a small fossa here, all right? And that's the conoid fossa, and then you have a small fossa over here, okay? All right, but you can't see those very well. All right, but there's two small tiny fossas here. So you can see, you have two small fossas, but you can really see, all right, you can see the trochlea really nice, and you can see the capitulum really nice. All right. So here's the trochlea. So those two structures, when they're as easy to see, then you know, okay, you're able to tell that you're on the anterior view. Because you'll see what I mean in a moment when I flip it over and show you the posterior view. Okay, so here's your medial epicondyle. I used another name for that, which I will no longer use. All right, but that's that big bump that's on the inside of your elbow. You have a nerve that sits right behind it. All right, that's the ulnar nerve. So when you bang that bone, it irritates the nerve and you get that tingling sensation. But you can see it's so pronounced. It's huge. Feel it on yourself. That's not cheating. You can do that. Okay? All right. So we have the medial epicondyle. How do I know it's the medial epicondyle? No problem. I'm just going to shoot up to the top of the bone here. Oh, there's the head. Head's always on the medial side. Okay? Head's on the medial side. All right. So now what I'm going to do is I'm going to flip it over, and I'm going to show, if you thought the medial epicondyle looked big here, flip the bone over. Look how big it is, how big it's, or how pronounced it is on the posterior view. This is the posterior view. And another way I can tell that I'm on the posterior view is, look, huge fossa here on the back. There's only one. There's only one fossa on the back of the bone. And I can't see the capitulum. I can see part of the trochlea, just a little bit of the trochlea. That's it. Okay? All right, so those are some of the ways that you can tell. All right, you can see this big fossa. We'll learn its name in a second. All right, the medial epicondyle is much more pronounced. I can only see part of the trochlea. Can't really see the capitulum. All right, going back to the anterior view. All right, now we're on the outside of the humerus. Okay, so this little bump here, that's the lateral epicondyle. It's on the same side as your greater tubercle. And the greater tubercle is lateral. That's the lateral epicondyle. An epicondyle is a little bump above a condyle. And actually the trochlea and the capitulum are considered the condyles of the humerus. We just give them special names. All right, so let's flip it over. Now we're on the posterior side. Look, big old fossa on the back. All right, there's the lateral epicondyle right over here. All right, So we go back to the anterior view, and right above our trochlea is the coronoid fossa. Look at that spelling. We've seen it before. All right, remember the coronoid process in the mandible? Spelled the same way. Okay, we're just in a different part of the body. This is the coronoid fossa. The fossa is right above the trochlea, anterior view. So speaking of fossas, let's flip this bone over, look on the back, and there's that huge fossa that I was telling you about earlier. That's the olecranon fossa. Part of the olecranon process, when you straighten your arm all the way out, will move into that fossa. It accommodates it so you can straighten your arm out. It's the olecranon fossa. So when you see the olecranon fossa, you know you're on the posterior side of the humerus. Yeah. All right, I'm done with the humerus. Let's move on to the forearm. All right, not as much to know, okay? Not as much to know. So there's two bones in the forearm. You have your ulna and you have your radius. Okay, when you're in the anatomical position, the radius is the more lateral, the ulna is the more medial. So this is the proximal end of the ulna. This big fat end that looks like a Pac-Man. Okay, so this is the olecranon. Here's the olecranon process. So if you feel your elbow, that bump that you feel on your elbow, that is your olecranon process. So when you touch your elbow, you're touching this part right here. Yeah, there you go. That's your ulna. Okay, that's your olecranon process. All right, so you've got this little groove here. So we call that the trochlear notch. So guess what? The trochlear notch articulates with the trochlea of the humerus, the bow tie structure. All right, so you can see now here on the ulna how it articulates with the bow tie structure. Now I'm going to just rotate the bone a little bit so you can actually see it. This is just a side view of it. Now you can see it from the anterior view. So if I were to draw in, here's the trochlea. The trochlea would sit like this. Right there. It's not a bad drawing. Okay? So the trochlear notch is going to articulate with the trochlea of the humerus. Okay, so at the bottom portion, this right here, this little lip-like structure. Okay? That's your coronoid process. Remember, we saw the coronoid fossa, that little depression above the trochlea. So as you're flexing your elbow, the coronoid process moves into that fossa, so you can bend your elbow more. Okay? So the humerus makes a lot of accommodations for the ulna, believe it or not. Makes an accommodation on the backside for the olecranon process, and then it makes an accommodation for it on the front side for the coronoid process. I think the humerus is pretty nice that way. All right, so here you can see the coronoid process here from the anterior view. All right, then we got a little smooth area right here. Because remember, the ulna and the radius are close. They're very intimate. All right, they meet up two different times. All right, one on the proximal end. All right, so where the head of the radius articulates with the ulna, we call that the radial notch. Okay? Nice smooth area there. So that's where part of the head of the humerus, did I say humerus? Radius, excuse me, the head of the radius is going to articulate with. All right, so now let's go down to the distal end, down here. All right, and there's only one little thing you need to know down there, and that's that little nubbin. All right, that's the styloid process of the ulna. So you can feel it. Remember I told you when you're feeling those bones that stick out on either side of your wrist, if you're on the pinky side, you can feel the styloid process, all right, of the ulna. That little bump there to help to keep the carpals in line. All right, almost done. Let's move on to the radius. Okay, the radius is the more lateral bone of your forearm. All right, again, this end here, this is the proximal end. That's going to be closest to your elbow. Okay, so that disc-like structure on top, that is the head of the radius. It's in the shape of a disc. But what we can't see is if we were to look down on the top of it, of our disc, there's a depression in the middle of it, a little hole here. And that's where the capitulum sits in. Okay, remember, the capitulum is that ball-like structure. So when you go for supination and pronation, it swivels on top of that. And that's what helps us to allow supination and pronation. All right, going down below the neck, going more distal from the elbow is the neck. And then you can see there's a bump here. All right, that bump is a site for tendinous attachment. That's the radial tuberosity. Your biceps tendon attaches onto the radial tuberosity and it helps you to bend or flex your elbow. All right, I'm bored with the proximal end. Let's go down to the distal end here. All right, there's our nubbin. Okay, that's that other little bone that sticks out on your wrist by your thumb. That's the styloid process of the radius. Don't forget, I told you folks that the ulna and the radius are intimate and they meet up twice. They meet up proximally, all right, and now they're going to meet up distally. And at the distal end, you can see on the side opposite of the styloid process, all right, we have the ulnar notch. That's where part of the ulna articulates and brushes up against the radius. OBKB, that's it for the forearm. We're almost done. We got to do the hand. We'll do the wrist, and then we'll run through the metacarpals and the phalanges. Okay, so let's do it. Silly lovers try positions that they can't handle. Here's the silly. All right, there's the scaphoid. So here is the thumb. So this is digit number 1, and the pinky is digit number 5. So always starting with the thumb. All right. Remember, carpal bones they're in 2 rows of 4 bones. So we're going to start with the proximal row. The proximal row right here. Okay. So the proximal row, the first bone is the scaphoid. Okay, we go over towards the pinky. The next bone is the lunate. Now listen, don't, because we're dealing with technology, okay, and it's tough to tell. All right, here's the scaphoid. Here is the lunate. It's overlapped. There's another bone over here. So here's the lunate right here. Okay, it's tough to see. Not all of that. This whole thing is not the lunate. All right, let me refresh. Okay, so right here, that's the lunate. It's just tough to see because there's a lot of overlapping of bones. Trust me on this. Because when I show you the next slide, you're going to be like, what? All right, so there's the lunate. The lunate, what is it proximal to? The lunate is going to be proximal to the hamate. Proximal to the hamate. On the hand, or are you talking about, wait, you said that is the hand. Because this is in the proximal row. You mean, when you want to know what it's proximal to, then you're in reference to the distal row. Or do you want to know the forearm bone? I guess I'm confused by your question. Let me go through the other bones, and hopefully, Candace, I'll answer your question, okay? All right, let's zoom back out. So now that's the lunate. We'll move to the next bone. Now watch the arrow move, okay? Boom. Yes, this is in the wrist. So again, because of this view here, all right, here is the triquetrum. Right there. Yeah, this is still in the wrist. The carpal bones are the bones that make up your wrist. Right, and then the final bone, this little pebble-like bone right here, that's the pisiform. That's this little bone. So again, it's not easy to see, but I'll draw this line here. Okay. So that's the triquetrum there, and that's the lunate there. The proximal row is a little bit more confusing. I promise you the distal row is much easier. Look how easy this is. Here's the trapezium. Easy way to remember the name of the trapezium. It articulates with the thumb. They both end in M. Well, the thumb ends in a B, but you know what I mean. The B is silent. Trapezium, thumb. That's how I always remembered it. Okay, so that's going to articulate with the first metacarpal. Then the next bone that we're going to see is going to be the trapezoid. That's going to articulate distally with the second metacarpal. Okay, this is 2. This is 1. This is 3. This is 4. And this is 5. Okay. So we move one more over towards the third digit, and that's going to be the capitate. That articulates with the third metacarpal. And then our last carpal bone articulates with the fourth and fifth metacarpal. That's the hamate. So I'm going to draw a line in between the two rows. Okay. Dang it, I hate when it does that. So everything below the blue line here, right, is going to be the proximal carpal row. Everything above it is going to be the distal proximal row. Oh wait, no wait, I drew that line wrong. Good thing I was paying attention. One more time here. There we go. Okay, so everything below it is the proximal row. Everything above it is the distal carpal row. So the distal carpal row will articulate with the metacarpals distally. Okay, so metacarpals are easy. Check it out. First one on the thumb. Thumb is always number 1. Metacarpal number 1. These are the bones that are in your palm. You cannot see them individually like you can see the phalanges. Okay, so metacarpal number 1 is the thumb. Metacarpal number 2 is going to be your index finger. Okay, when you're pointing at things. Metacarpal number 3, that's your swearing finger. Okay, middle finger there. Ring finger is going to be metacarpal number 4. You need to be using the Roman numerals. And then lastly, okay, metacarpal number 5 is going to be your pinky finger. No one should lose any points on that. That should be easy. Easy, easy, easy. All right, last part, phalanges, easy. And guess what? If you know what we're from metacarpals out to the phalanges, if you know that pretty well for the hand, well, the foot will be easy because it's the same thing. Instead of saying metacarpals, in the foot we say metatarsals. Easy. Same numbering system, same number of phalange bones. The big toe only has 2, just like the thumb. Easy, easy. Okay? All right. So let's jump in here. Almost done. Okay. All the digits have a proximal phalanx. Okay? You can say phalanx or you can say phalange. I don't care. Okay? Right, there's an L in there. Forget it. You guys know how to spell phalange, right? If not, okay. Phalange. Either or is fine with me. Okay. So, all the digits have a proximal phalanx. All the digits have a distal phalanx. Only digits 2 through 5 have a middle. And you're going to name them with the same Roman numerals that you use for the metacarpals. So the thumb is number 1, the pinky is number 5. All right? So you can see here Okay, the proximal phalanx number 1, all right, articulates, all right, with metacarpal number 1. Here's the distal phalanx number 1. And remember, the thumb only has 2 phalanges, a proximal and a distal. Okay? So when we get here, I'm not going to go through all, I don't have labels for every single phalange. I'll let you fill in the rest. You should see the pattern going on here. All right, digit number 2, your index finger. Here's your proximal phalanx or phalange 2. All right, here's your middle phalanx 2. And then finally, distal phalanx 2. So I'll let you fill in the rest. I'll do a couple more, all right? So the 3rd digit is 3, the 4th digit is 4, the 5th digit is 5. Okay, so here I'll show you. I guess I won't show you. Yeah. That's it. That's it for identification. I'll let you fill in the rest if you haven't done so already. Okay? Are your brains full? Are you ready to be excused? Okay. Well, that's it. Now, on Wednesday, we will, or excuse me, on Thursday, we will finish up the appendicular skeleton. Okay? And so you'll be fully satisfied with all of the skeleton and ready to go. Any questions from you folks at home? Alexis, did that answer your question? Is that a bone of the wrist? And I know we were referring to the carpal bones. Any and all the carpal bones are going to be a bone of the wrist. So that's going to be all these bones that you see here on the screen right now. Those are all carpal bones, wrist bones. All right, I hope you can hear me at home. All right, anyways, take off, sign out. All right, have a good couple of days, and I'll see you on Thursday. If you have any questions, let me know. Okay. All right.